Thank you, thank you, thank you. Let me was normally. Good evening, everyone. Good evening, good evening, good evening. As many would say, share the live. Feel free to share the program. It's not some information for myself, but share the program. The doctor is in the house and will be coming with you shortly. Okay. Okay, we're a little. All right, thanks to everyone who tuned in already. And feel free to share the program. The doctor is in the house, and that's something that everyone like to hear. When we're going through something, we say, we need the doctor. The doctor is on call. The doctor is in the house. And tonight, we're definitely going to bring some important information. And as we get ready for the 9 o'clock hour, we will just ask everyone who is under. Thank you so much. Feel free to share this program. This information is not for us to keep, but the information that we will be hearing tonight should be information that we all should share with each other, friends or family. So thank you wherever you are tuning in. And we are joined here by the doctor himself. And many times I try to pronounce.
That's okay, yeah.
I always got to mess it up, but we're not going to mess up the doctor's name tonight. You know, many doctors being accused of many things, but not our doctor that's in the house. And it's amazing. I just want to welcome you back to the Avril Show.
Thanks so much for having me, Avril. It's great to be with you.
Okay. And we're getting ready to start shortly. And we know someone says, should I share it? That's not a question to ask. Always feel free to share information that's important to your friends and loved ones. And that's what helps us to help each other. Each one reach one. And tonight we are going to, many people are out there and everyone always want to hear information because everybody's concerned. Even myself have a whole lot of questions that we would like to ask. And you know, we've been communicating with some of the questions that people are asking. Strange questions to some, but if people are not, if they don't know, we can't say that it's a stupid question. You know, if they don't know, they just don't know. But we look to experts from you. And for those who've seen the Dr. Eric for the first time, I would like to give you the opportunity to introduce yourself.
Sure. Thank you. So my name's Eric Meyerowitz. I'm a infectious diseases physician at Montefiore Medical Center in the Bronx. And it's good to be back. I was here, maybe it feels like maybe it was about 6 months ago or so.
Yes.
But yeah, and I see patients, and I've been involved with a lot of seeing a lot of COVID patients over the course of the pandemic as well. So I'm happy to be here, and I think, yeah, like Avril's saying, it's very common. It's normal to have questions, and so what we're going to try to do today is go through the questions that you have and try to get some good and hopefully helpful information for you.
That's right, because you're hearing so many questions. Good evening, Joycelyn. Thank you so much for that. Folks are asking questions, and one of the first question, and I know many shows, they wait for everyone to log on before they start the show. But we know that folks are going to see the show either now or later, but this information is for us to share. So right now we're going to go right into the show. And everyone around, especially in the Bronx, you have to know of Montefiore, Einstein, so College of Medicine, And I know most of my viewers, followers are Montefiore Einstein patient. And good evening to you, John, who says they saved my life the other night with an open heart. And I just want to go into one question that is very confusing. Hello from Tallahassee, Florida. Vivian, thank you so much. And one of the questions that is very buzzing to me is the question that many people, we have this word that we use, I'm fully vaccinated. And that's the one thing that have me confused when folks say, I'm fully vaccinated. So they don't wear the mask. And the first thing you walk up to someone without a mask, they look at you, they say, hey, I'm fully vaccinated. So I would like to understand, I have said to many people, if the CDC and the doctors are telling us the percentage of the vaccine, how can we be fully vaccinated? Why don't we feel the need to wear a mask? Because we take the first shot, many people take down their mask. The second shot, they say, oh, I'm fully vaccinated. Can we elaborate a little on why you think so many people are using fully vaccinated?
Yeah, so typically what people mean when they say they're fully vaccinated is they've gotten the single dose of the Johnson & Johnson vaccine, or they've gotten 2 doses of either the Moderna mRNA vaccine or the Pfizer BioNTech mRNA vaccine. And so until very recently, that was considered so-called fully vaccinated, right?
Mm-hmm.
Those are the regimens that were studied in the famous trials, which came out starting at the end of starting about in first in early December, then in later December, and then a couple months later for the Johnson and Johnson, right? So that's where those initial efficacy numbers that we talked about last time came from, right? When we were talking about, around 90%, 90 to 95% efficacy in the trials in terms of preventing symptomatic COVID infections among the people who were vaccinated. And so in the first 6 months or so after those trials came out, so say from the time from December until May and June, the vaccines were studied, even further, right? They were being given very extensively based on that really excellent data from the phase 3 trials. And what became clear was, in addition to preventing most symptomatic infections, they also decreased the risk of transmission from people who happen to get what in the media is often called a breakthrough infection. So what a breakthrough infection is, right, is where someone is, quote, fully vaccinated, but gets a symptomatic COVID infection, right? Which is rare. It does happen. And we're going to get into this a little bit later as well, but we're seeing it perhaps a little bit more now with this Delta variant. But what became clear was that in addition to preventing most symptomatic infections, the vaccines also decrease the risk of transmission, meaning that if you have 2 people who have COVID and one of them is vaccinated and one is not vaccinated, and you have someone else in the room, let's say, who does not have COVID, they are much more likely to get COVID from the unvaccinated person as compared to the vaccinated person. Okay, so based on these facts, one being what we knew from the trials, that there's a massive decrease in the amount of symptomatic infections, and 2 being, as we saw it deployed even more among people who were having infections after being fully vaccinated, these people were less likely to transmit. That was what led to the CDC earlier in the year saying that, for fully vaccinated people, it was essentially okay to take your masks off regardless. And so and I think at the time that was very, very reasonable based on all the data that we had.
Right.
Yeah. And so, and I think what we'll get into, and maybe what we can talk about in the next few minutes as well, if you'd like, is
Sure.
What happened subsequently. What happened after that, right? Was we started to see the Delta variant, which we can discuss a bit as well. But the most important thing about the Delta variant is it is actually significantly more transmissible than the old virus. Okay, so it is the Delta variant. It is still the COVID virus, but
Okay.
but so it's not a new virus. But what happens with these sorts of viruses is over time they develop, they're able to accumulate some mutations. And if those mutations are favorable to the virus, then the viruses with those mutations will get into people more efficiently, and we end up seeing more and more of those. And so the Delta variant is still COVID, but it's COVID that is much more transmissible than the old virus. Okay, and so that that initially was spreading extremely effectively, primarily in unvaccinated people. What's happened a little bit more recently is, I think, largely because there were so many Delta cases in unvaccinated people, we were seeing some spillover into people who were vaccinated. And so that has led a lot of places, including New York City and many other places, to recommend revising some of those earlier mask rules, right? As cases go up, to say that it's probably reasonable to continue to have some of those older mask recommendations or even requirements, right? That we were starting to relax in the spring, but in the setting of having so many cases, to kind of think about, in some settings, having those come back.
So when you said you've seen some of the Delta, the people that are fully vaccinated are still able to catch the Delta virus.
So the Delta, it is significantly more transmissible than the original virus. That's clear. There is a little bit of an erosion in that 90 or 95% efficacy against symptomatic infection, and there's a lot of different studies that are out there that are looking at this. It's hard to say exactly how much more at risk vaccinated people are with Delta, but there is at least a small increased risk. Now, the vaccines still prevent they're still preventing a significant amount of symptomatic Delta infections, and most importantly, there is no good evidence that the vaccines have lost the ability to prevent people from getting hospitalized or die. So let me. This is a really important point. So I'm going to try to say it a different way as well. The vaccines are still incredibly effective at keeping people alive and keeping them out of the hospital. And so what we probably have seen a little bit of an erosion with in this age of Delta is there are more symptomatic breakthrough infections among vaccinated people. However, they tend to be milder infections. So what a mild infection might look like, it might look like something as simple as a head cold. It can look a little bit more like a flu, but it tends not to be what we used to see with unvaccinated COVID, right? Where people, if people were getting significantly ill from COVID, in an unvaccinated setting, there's a big risk, right, of needing to get hospitalized, of getting COVID pneumonia, of needing to be on extra oxygen, and occasionally needing to go to the intensive care unit for even more significant supports for breathing. Okay, so again, the vaccines are still incredibly effective at preventing severe disease from COVID, including from COVID Delta. Okay, but it's really this erosion in terms of seeing a few more symptomatic breakthrough cases.
But let me ask Dr. Meyerowitz, how do you know the difference between, we all hear of COVID-19 for so long. How do you know the difference when someone come in, if they have COVID-19 or if they have the Delta?
Yeah, so the way that is known is every time a swab gets done, a certain random sample of those are getting sent to our State Department of Health or to the CDC or both, and they are doing the genetics to look for these specific mutations to determine if it's original COVID or if it's COVID Delta. What we know now is, greater than 98%. So essentially 100% of what we are seeing now is the COVID Delta, meaning it is still COVID, but it's the COVID virus that has accumulated some of these mutations that most importantly give it the ability to be transmitted more easily between people.
Okay, so I was always worried about that. I was trying to figure out, how do you know if I have COVID-19 or Delta? But you just answered the question. And now, I'm glad you said earlier, for those who missed it, Roman Rosa, good evening to you. And Carlene, good evening to you so much. Thank you for joining. The problem I'm having is, I always tell folks, it cannot get better until we start listening to wear your mask. But a lot of people, what I'm hearing is, I'm fully vaccinated. So you can't tell grown folks if they should wear the mask or don't wear the mask, because it's been told to everyone, wear your mask. And there is nothing that says, because you have the second dose, you're free to not wear your mask. Or is it something I'm missing?
So I think part of this gets back to what happened earlier in the spring. So earlier in the spring, when we were not seeing a lot of Delta and cases were very low, the risk to a vaccinated person to get a breakthrough infection was tiny. And now, as there are more cases throughout the country, right, including in New York City, right, there's more cases now, and it is of this more transmissible, more easily past COVID, this COVID Delta. I think the risk of having a symptomatic breakthrough infection is higher, and that's what has led places like New York City and other places to say, even though earlier we had a lot of the mask mandates were taken away, now probably in some settings it does make sense to put a mask back on, because really there's at least three different reasons. One is we have a lot more cases of the COVID Delta that are circulating right now. We think the second reason is, we think with this Delta virus, this Delta variant, the risk of you, even though you're fully vaccinating, having a breakthrough infection and probably almost certainly not needing to be hospitalized yourself, but potentially passing it on to others, that risk is higher now, right? Because it's a more transmissible virus. And thirdly, there are still a lot of unvaccinated people out there, and so because of how transmissible this is, they are at the highest risk, right? So So for all of those reasons, I mean, I think it is very reasonable, as our case numbers are up, as people are still getting vaccinated. If you're in a high risk setting, right, with people where you're indoors, where there's a risk of transmission, it is so easy to put the mask on, and you're lowering the risk for yourself, and you're lowering the risk for the other people in the room with you. Now, however, there's one most important thing that we could do to make progress against the pandemic and against the Delta variant, it would be to try to help people get to try to help more people get the information they need to be comfortable enough to get vaccinated. So what we've seen is, for instance, in San Francisco, which is one of the most vaccinated cities in the United States, they have had a very different experience with Delta, with fewer cases, with a lower peak than most other places in the U.S. And so
And why is that?
That's because the more people you get vaccinated, the risk of transmission is going to be lower, right? Because we know that even if you were to develop a symptomatic breakthrough infection, your risk of transmission is lower as a vaccinated person than the same person who has COVID Delta who is unvaccinated, right? So you are more likely to pass it to more people if you're unvaccinated than if you're vaccinated. Every time we can decrease the amount of transmission that's happening, we're going to have fewer new people who are getting infected, which is always super important, right? And the other thing is the vaccines. So even though there are more symptomatic breakthrough infections, we are still preventing. Every vaccinated person is as we vaccinate more people, we are preventing a lot of infections, right? So remember those early numbers from the trials that we talked about last time, right, where it's we were preventing greater than 90% of symptomatic breakthrough infections. There is probably, right, we're accepting that there's some erosion to that now. So and it's not totally clear whether we're more like 60% or closer to 80% in the time of COVID Delta. I think it's probably closer to 80%. But we're still preventing a huge number of infections on a population level as we're more vaccinated.
Okay, and one of the question that I know that bothers me is so many people was saying that the vaccinated people is the one that's spreading it more because they don't know they have it. So I know someone just a few days ago who said until she was told that someone who was, for her work had the infection, she went and get tested, and that's when she found out she was positive. So folks are walking around with COVID and not aware.
So one of the strange things about COVID is there is a really wide set of symptoms. So on the one hand, right, we see some people who get so sick with this terrible pneumonia that they need to go to the intensive care unit, and some people die from this, right? On the other hand, we have some people who get mild flu-like symptoms even when they're unvaccinated and recover. And there are some people who are completely asymptomatic, meaning they are infected but have no symptoms whatsoever. And so among unvaccinated people, that is probably about a quarter of people. So 1 in 4 people may have a persistently asymptomatic infection. Okay. What we know is that if you are asymptomatic, you're actually much less likely to spread the virus compared to someone who is symptomatic. And one of the reasons for that is when we measure the viral load, how much virus you're carrying in your nose and in your lungs, an asymptomatic person has far less virus than a symptomatic person. Okay, so there are some vaccinated people who can get a asymptomatic infection. So those people would not have been captured in the trial, right? The trials were looking for symptomatic for symptomatic breakthrough infections. There are some people who are vaccinated who will have a persistently asymptomatic infection. However, those people will be less likely to spread the virus for two reasons, right? One is we know asymptomatic people have a lower viral load and are less likely to transmit than symptomatic people. And secondly, we know vaccinated people are less likely to transmit than unvaccinated people. So the vast majority of transmission is coming from unvaccinated people. Okay, because right, so symptomatic unvaccinated people that's the people who tend to transmit most. After that, right, symptomatic people who are vaccinated, right, because they're going to have a higher viral load than asymptomatic people, and then asymptomatic people who are vaccinated, it would be very unlikely for them to spread. So we're right for all of those reasons.
So you're saying that, to be clear, for someone who just texted me, someone who is vaccinated, they cannot spread it to someone who is not vaccinated? Because if I'm fully vaccinated, right, and I get the Delta, okay, variant, can I spread that to someone who is not vaccinated?
So if you were in a situation, so if someone is fully vaccinated and develops a symptomatic breakthrough infection with Delta, meaning they have so the most common symptoms would be cough, runny nose, maybe fever, right? If we know someone like that, right, they are going to be able to spread the virus. The highest risk for spreading is within the household, right? So if you had an unvaccinated person in your household, they would be at highest risk for getting or for getting COVID from you in that situation. Okay, let's say you had a vaccinated person in your house. They are going to actually block the infection about 50% of the time. Okay, they're not going to have any symptoms. We know the household is the most, right? It's the most. You're in tight quarters, right? You live together. Think about all the interactions you have. Maybe you eat meals together. You're sharing food, right? Bathrooms, etc. Right? So that is the highest risk setting for transmission. A really good study came out in the last couple of weeks that showed vaccinated people in a household. If you vaccinate people in the household, the transmission rate goes down by half. Okay, but it doesn't go to zero, right? So there is a risk. Now, remember, if everyone in the house is vaccinated, the risk of having a severe outcome is extremely, extremely small, right? Because the vaccines prevent severe disease. Whereas for unvaccinated people, the risk of severe disease remains high.
But let me say this to be clear. But if I'm in the household with Cheryl, mm-hmm. and Colleen, three of us together, all three are vaccinated, but I go out and probably picked up the Delta. Can I spread it in the house to the other two vaccinated people?
So yes. The fact that everyone is vaccinated helps, but you can still spread it, right? And so if you develop, like if you were doing something that was maybe a little bit higher risk, if you were in a situation where you maybe you were out with some people and you found out that somebody had COVID, then I think doing the same things that we talked about to try to help prevent transmission, even to vaccinated people in your house, is helpful. So trying to keep some distance, opening a window. If you're in really close proximity, keeping the mask on even in the house. If you're in that situation. So again, I'm not saying keep your mask on all the time in the house, but right. if you had an exposure, or let's say that you did have symptoms, right? If you do have symptoms, you should still get tested, because it's important to confirm, right? Because there are other respiratory viruses out there, things like the flu and other things, right?
Right.
So you want to confirm that it's COVID, but if you've either had an exposure or you have symptoms, you still want to take those precautions to protect the people in your household. But you also know that they are the fact that they're vaccinated does protect them quite a bit, both from getting symptomatic infection and most importantly from getting super sick.
So you're saying once they're vaccinated, then even though we spread it to each other, we get less sick. But
Exactly.
It's still what I want people to understand, because the question is, a lot of folks think because they're vaccinated and I'm vaccinated, we cannot spread it to each other. So you're saying that it's possible that even though we are vaccinated, we can still spread it to each other.
Right. And if I could just add, so now let's say everyone was unvaccinated in the household. The risk of spreading it is far, far higher, right? So I think it is. So an unvaccinated person with infection is more likely to spread, and an unvaccinated person in a household is more likely to become infected. So by being vaccinated, you are still protecting yourself a great deal. But as you're saying, it's not 100%, and you can still get these. You could still have most likely mild symptoms, right?
Okay.
Yeah.
And one of the questions Cheryl asks, what is the update regarding needing a booster vaccine after a period of time? And if so, what is the time frame? 6 months, annually, or?
Yeah. So that's a super good question and very, very important. And that has all changed in the last couple of weeks as new information has come out. So there's two instances in which a booster is now recommended. So the first was a couple weeks ago. There was an announcement about people who have weakened immune systems. And this is not someone who thinks they tend to get a lot of colds, or maybe have thought that they have a weaker immune system in that way. You have a weaker immune system because of certain medical conditions, perhaps HIV, certain cancers, or your doctor is prescribing you certain medications which weaken your immune system, perhaps to treat another condition. Okay, so these are things that you would know about because you're working on them with your doctor, and there's a list of conditions. So in this situation, a booster is recommended because you started with a weaker immune system. We know that the response to the vaccines was not as strong as someone who starts with kind of a bit of a stronger immune system. And there is really good data that shows that a third dose, typically this is going to be with either Pfizer or Moderna, one of the mRNA vaccines. So a third dose is really helpful and can help boost your antibody levels and can help keep you safe. Okay, so that's one group. Then I think it was last week, although the timeline is getting a little bit blurry, but it was either last week or the week before. There was a big announcement about general boosters. Okay, so this comes from the country of Israel was one of the countries that was able to get many people vaccinated very, very quickly, actually even quicker than we were able to do in the United States. And so they had a lot of people who were vaccinated very early, kind of in January. And they have showed with some preliminary data that for people, particularly people over 55 who were vaccinated in January, so about 8 months ago, the risk of symptomatic infection of these breakthrough infections that we've been talking about seems to be higher than if you were vaccinated more recently. And so what that suggests is that there may be some waning, some decreasing of the antibody levels after a period of time. And so what the CDC and FDA and these groups decided is to recommend a third dose. So if you started with the Pfizer vaccine, right? If your first 2 doses were Pfizer, you would complete your series with Pfizer. if your first 2 doses were Moderna, you would complete your doses with Moderna. Although, quite frankly, these are quite similar vaccines. So if that wasn't possible, you could talk to your doctor, but it's likely that you'd be able to do an exchange because they're so similar. But the idea is 8 months after your last dose, you would be eligible for a booster. And what boosters do is they increase your antibody levels more than 4 times what they were before the booster, and the hope is that they're going to stay high for a while after that. So I would just make another comment about this, which is many of our vaccines that we use are actually 3-dose vaccines. Okay, so one way to look at this is what this may end up being is the completion of a 3-dose series. Okay, so for instance, the hepatitis B vaccine, which is a very effective vaccine that is recommended for all infants, that's given as a 3-dose vaccine. Okay, at 0 months, 1 to 2 months, and then 6 months. And so this is a very common sort of timeline for vaccines. And one of the things that immunologists think is the 3rd dose. So the first 2 doses, everything that's happening in your body in terms of making antibodies and other components of the immune response is sort of more mature, and the 3rd dose can truly serve as a more longer term booster that will hopefully keep these levels up longer term. And in terms of just to answer the last part of that question, in terms of whether this will be whether there will be subsequent doses after this, we don't have enough information to say right now. I think a lot of people feel like this may do it. But again, part of living through this pandemic, right, is I think we have to accept a certain amount of uncertainty in the minute and understand that there are doctors and scientists and public health people that will be studying this really closely. And if we need to make adjustments in the future, there will be strong rationale one way or the other.
And it's funny that you say that, because a lot of people I spoke to, including myself, when you say, how come you didn't take it already? They say, I was just waiting for more information, more updates. And would you consider that a bad thing to do, that people decided to, some folks say they just wanted to be comfortable. They want to hear more information.
Yeah. So I think it's extremely important for everyone to get the information that they feel they need. I think it's also important to say there has probably never been other vaccines that have been studied this closely and given this widely. And so I think the safety data that has been generated is tremendous, and the effort that has gone into overseeing the rollout and making sure that that every data point is being captured. It really is extraordinary. So I think I think a forum like this hopefully can help answer some questions for people. But yeah, I think it's critically important that everyone gets all of the information that they need about these really important topics.
Yes, and thank you. And for those who just joined in, Shirley, Problem, thank you so much. We're talking to Dr. Meyerowitz, Montefiore, Albert Einstein College of Medicine. And so we're giving you information tonight instead of assuming and hearing all these things that we're seeing on social media. We bring the experts to you. And Cheryl asks a question: is it safe to say the vaccine reduces symptoms more so than preventing infection or spreading?
That's a great question. So the clinical trials looked at symptomatic infections, right? And so they weren't exactly able to tell us, well, does it actually reduce all infections? Now, since the clinical trials, there have been numerous studies which have shown, in fact, the vaccines actually do prevent a significant amount of infections. So in the pre-Delta period, if the prevention of symptomatic infections was say 90 to 95%, the prevention of total infections was at least 60%. Okay, so you're preventing in the pre-Delta period, you're preventing at least half of infections, and we don't have great updated data in terms of how many infections we're preventing in the age of Delta. You know, there is a second thing that's important to keep in mind. So Delta has come, but a lot of people got vaccinated, you know, more than 8 months ago now, right? And so we're dealing with these two things, like what was happening in Israel, right, which I mentioned, where they showed that people who were vaccinated more than 8 months ago had a higher risk of these infections. And so so it is a little bit hard to tease out how much of this is truly from Delta and how much of this is from the time lapse and the waning of antibody levels. Fortunately, the booster recommendation should help with both of those issues. Okay, so having higher antibody titers, we know from lab studies that higher antibody titers are very effective at neutralizing Delta, and so yeah, so it will restore for people that have had waning where their levels have gone low. In general, getting the booster will help bring them back up.
Okay, and Shirley Trupico is asking, should you check your antibody level before taking the third booster?
It's a great question. So, you know, unfortunately, there is not a standardized way. There's not a standardized antibody test, and in fact, there are many tests, including some that test for prior infection, but not vaccine. So, it's a bit of a complex topic, but there are some antibodies that you will only have if you had prior infection. Okay, and there's some antibodies that you'll have if you've been vaccinated. Okay, and so one of the issues is we don't have a standardized antibody test yet that can tell us if you're below a level where you really need to, where your levels are too low and you need a booster. This is an area that's really being actively studied, and so I think there's a chance that this will happen in the next several months, where we'll have a better sense of, yeah, you know, if your spike antibody is below a certain level, that indicates you've lost protection and you should get a booster. So that may be where we're headed. Right now we don't really have that. We don't have that capability. And the second thing, if someone is checking your antibody levels, it's important to make sure that they're checking those spike antibody levels and not the antibody from prior infection. Because I've had some people come to me who have been vaccinated and have an antibody checked that is negative, and it turns out the antibody that was checked is not the spike antibody. And right, so you could have a negative antibody because it's the antibody from infection, right, from natural infection and not from vaccine. So if you're doing this, you want to make sure that you're doing it with a specialist that is ordering the right tests. But again, it really is not recommended now, because even if you got a spike antibody level, we don't yet know what the thresholds are.
Wow. So a lot of times folks go to the doctor and they say, oh, I checked my antibody and it's positive, so I don't need the vaccine.
Yes. So right now you could have a positive spike antibody, but the level could still be relatively low. Okay, so you could be above the positive threshold, but you could still be at a relatively low level where a booster would be beneficial to you. So again, I think this is definitely an area to keep an eye on, because it may change, right? The best situation would be if we could get a test that would tell us what your risk for a breakthrough infection was, right? Like if we could check an antibody and we could know your level's too low, you're at risk, you need a booster. Which again, that may be where we're going, but it's not where we are now. So,
but when you say the booster, go ahead. Finish what you're saying.
Yeah. So I would just say I would not use the spike antibody test as a way of thinking about what your risk is, and whether or not you should get a third dose.
Okay, but what for someone who never take the first or second vaccine, but they check their antibody and it come back positive? Should they take the first and second shot and
Great.
the booster, or?
Great. Yes. So, okay. So for someone who never got vaccinated but has positive antibodies, that means they had prior infection. And some people may be surprised by that, right? I was telling you that about 25% of people have fully asymptomatic COVID-19, meaning they may have had no symptoms, right? And so you could get an antibody checked and you could be surprised. It could be positive. Now, what we know is that someone who had prior infection who then gets vaccinated has better immunity, better protection against future infections than if they didn't get vaccinated. So vaccination still helps you. In fact, if you had prior infection and you got vaccinated, so let's say you had prior infection and then you took 2 doses of either the Pfizer or the Moderna vaccines, your antibody levels are actually higher. They tend to be higher than people who did not have prior infection and just got the 2 doses of either the Pfizer or the Moderna. And probably the way to think about that is the vaccines themselves are kind of acting like a booster for you. So in terms of whether someone in that situation would need then a third dose, that I think is not really known yet.
Okay.
In general, these getting a third dose, there is not. I'm not expecting people to have any different or more unusual side effects than with the other doses, right? It should be pretty standard, which is what we see when we give other vaccines, right? The reactions, the side effects tend to be similar when you get your subsequent doses. Wow.
So I just want to be clear. I just heard you. We're talking to Dr. Meyerowitz from Montefiore, Albert Einstein College of Medicine. Josephine Kelly, I'm coming to you. Problem Foods, I'm coming to you also. So you're saying if I never knew that I had the virus, but I happen to be at the doctor and I check for my antibody, comes back positive, it means I have some kind of immunity. Okay.
Yes.
But for someone who had the virus, do they also have some form of antibody and protection because they already had the virus? Because what I'm hearing from a lot of people is, oh, I had the virus, so I don't need to take the shot right now. And some folks say they was told they don't have to take the shot now because they had the virus.
Got it. Yeah. So this is a super important thing for us to discuss because it's pretty common too, right? So first of all, if you have not been vaccinated but you have your antibodies checked and they're positive, and you don't remember having, you were never diagnosed with a nasal swab and you don't remember having symptoms, you may be one of these people who had asymptomatic COVID, and having an antibody means that you do have some protection. However, there are numerous very good studies that show that if you are in that situation and you become vaccinated after that, you have much better protection than if you were in that situation and you chose not to become vaccinated. And probably the reason is because you had such a mild or asymptomatic infection, your antibody levels are actually not going to be all that high because in some sense, the amount of virus that you are exposed to is related to how high your antibody levels are. Okay, so if you have one of these asymptomatic or mild cases, you're likely to have lower antibodies, and we do see people who are in that position who subsequently develop severe COVID-19. Okay, so you are better protected than if you had no antibodies and had no prior infection and were not vaccinated. So you said you definitely have some protection, but it is you will have better protection if you get vaccinated.
Okay, that is great to hear, because there's a lot of folks who say, I just got out of the hospital, I just got over COVID, so I'm not in a rush to take the vaccine. But in other words, the vaccine now will make them even a higher chance of protection.
That's
A
right.
better
That's right.
chance.
Yep. So the one way to think about it is the vaccine will kind of supercharge your natural immune response. It will help you boost those antibody levels and the other components of the immune response even higher. Getting reinfected within 3 months, and some people may have heard this. So getting reinfected within 3 months of an initial infection is pretty unusual, and so there have been some people may have heard that they should wait 90 days to get the vaccine. So you definitely need to be outside your isolation period. So you need to be at least 10 days from your symptom onset, and you can't have had fevers for 3 days. If you wanted to wait the 90 days, that is reasonable. On the other hand, some people choose to get vaccinated as soon as they're kind of out of that isolation period and recovered from COVID. If you have specific questions, I think you should talk to your doctor. But those are that's kind of the spectrum.
Good. So you speak to your doctor because you're just coming out of having COVID. It's better to go back and sit down with your doctor to know.
That's right.
Your best.
That's right.
Because I know some people say, oh, someone with cancer and someone who has all this ailment should not take the vaccine. There is so much things, but as you say, they have a lower immune system now, so it's better to boost it.
Right. And you're right. It's hard to discuss, and we can't discuss specific cases because people do need to talk to their individual doctors. But in general, if you have other medical conditions, in particular things like HIV or cancer or organ transplants or really many other heart disease, diabetes, a lot of other conditions, you really should be vaccinated, because your risk of having a severe outcome from COVID is higher than someone who doesn't have those conditions, and the vaccine can protect you. And actually, if some people, so depending on the type of cancer, I've mentioned HIV before. Some people are going to be in that position where the boosters are already available, because they're in that. That kind of weakened immune system category, right? Which was discussed before general boosters. So general boosters are not going to be available until after September 20th. And the recommendation for those is 8 months after your last dose. But if you're in one of those other categories where you have a weakened immune system, and you're working with your doctor for whatever the condition may be, you can talk with them about the timing and whether you are one of these people who should get a third dose. Okay.
Okay, and someone asks if all the boosters are the same, because I was hearing there was a report that the Pfizer lifespan versus the Moderna lifespan, one was 6 months, one was 8 months. So after 6 months or 8 months, you get your booster. What if so do you feel that Pfizer and Moderna falls in the 8 months period of getting the booster?
So as I understand it, the current recommendation is for either of those vaccines, it will be, starting after September 20th, you can get a booster or a third dose 8 months from your second dose. So if your second dose, let's say, was February 1st, 8 months later would be October 1st. That would be the earliest time that you would be able to get your third dose. In terms of the studies, so sometimes what happens is, as we've come along, there are studies, as we've come along this year, studies have come out that report on how the vaccines are holding up at various time points. So 6 months, 8 months, etc. And often those get picked up in the media as saying the vaccine lasts for 6 months. What those studies usually have been showing is the antibody and the immune response can be measured for at least 6 months, because the studies are going out to 6 months. So in general, the Pfizer and Moderna vaccines are very, very similar vaccines. There are a couple of studies that have suggested that the Moderna vaccine, the durability of the antibody levels in the Moderna vaccine may be slightly higher than the Pfizer vaccine. Most immunologists and people that I've talked to believe that the third dose will kind of restore the levels in essentially the same way in both of those vaccines. So if you got one or the other, that is fantastic, and you know, and I think, you know, you could talk with your doctor, but probably the third dose would be, you know, kind of in the same series as what you had gotten in the past.
Okay, would you say someone who is on blood thinner, could they take the vaccine?
So specific questions like that, I think you should just discuss with your physician.
Okay.
But in general, you know, if you've had clotting in the past, for instance, or if you have cardiac conditions, the vaccines really would be recommended for you, because your risk of getting a severe outcome from COVID without vaccination is going to be higher anyway. And I should say, you know, the vaccines have been extremely widely, obviously, tested and given out to people with all sorts of medical conditions. They are extremely, extremely safe.
And tonight we're answering so many questions. We're talking about so many things. And the most important thing is wearing your mask. That's the first thing for those who tune in later in the show to Dr. Meyerowitz. We talk about wearing the mask because a lot of people have the misconception that vaccinated people cannot spread it to vaccinated individual. But we heard it here tonight. Please wear your mask, because we have the Delta, where so many people who said they're vaccinated, but it came down with Delta. And it's so people get a whole lot of, oh my God, how could she get it when she is vaccinated? And how this person have COVID when they're vaccinated? That's the question that you're hearing all over.
That's right. Yeah. Yep.
But it's possible.
Yeah. The highest risk to both transmit and to become infected is for unvaccinated people. But we are seeing that there is a risk of getting infection even if you're vaccinated, and rarely people who are vaccinated can pass it even to other vaccinated people. However, just to restate, as we've said a few times tonight, the vaccines remain incredibly effective at keeping people from getting severe outcomes from COVID. So keeping people out of the hospital, keeping people off ventilators, off extra oxygen, and keeping people alive. So the vaccines still work incredibly well in that way. And importantly, they do still prevent a lot of infections, a lot of symptomatic infections and asymptomatic infections. And though it is possible to transmit as a vaccinated person, your risk of transmission is significantly lower than for someone who had COVID who's unvaccinated. Okay, so the vaccines are still doing a really amazing job, and they're making a difference in all these different ways as well. But as you're saying too, Avril, they're not 100%, right? And so if you're in a high risk position, if you've been exposed to someone, particularly as we have a lot of cases in the city right now and elsewhere, if you've been exposed to someone, if you have symptoms of COVID-19, do your usual protocols to help keep other people safe in your household, opening windows, keeping masks on when you're around other people, distancing, etc. Yep.
Okay, and with the going back to school, I know everybody's thinking about the children, as someone says. I seen parents wearing masks, but the kids are not wearing masks. So I'm always trying to figure out if there's a age group that, because I heard Pfizer is what the kids are getting. Is it such a thing as the kids are getting Pfizer?
So the Pfizer vaccine is approved down to age 16. So there are high school students who are getting that vaccine. There are both the Moderna and the Pfizer vaccines are being studied in younger children, um, and so those trials are likely, we're likely to have data, I think really probably any time, maybe in September. And once those are approved, younger children will also be able to get the vaccines as well. But I think your point is an important one, which is children can get the virus and can spread it to others. And so most children, right, are unvaccinated, particularly if they're under 16. Actually, you can get vaccinated down to age 12 now, right? So if you're under age 12, you can you are going to be unvaccinated, right? Because it's not, unless you're getting it in the context of a trial, you're going to be unvaccinated, and you can get COVID and you can spread it to others. And so so I think families need to make decisions about what they're going to do. But I think there's a lot of reasonable people who are recommending masks at times in schools, right, where you're going to be in close contact, because you're by definition going to be around a lot of unvaccinated people. And so hopefully that is going to change over the next few months as the vaccines become available to younger children. But certainly for now, is very important to keep in mind, right? That when you're around children less than 12, they are currently unvaccinated and can definitely get infected and can spread it.
Powerful message that you send out here tonight, Dr. Meyerowitz. And I always wonder about parents who think of themselves and think that, oh, they're children. And I keep seeing young children getting this virus now. So I'm wondering why parents don't take it into consideration to let the kids wear masks. I've seen little kids with masks and they look so beautiful.
Yeah,
and
right.
they're just so
Yeah,
happy because they wear with masks with their parents. But we're protecting the lives of these young children.
Yes, right. So fortunately, the virus for most children does not tend to be severe, although there are children who get admitted and occasionally even die from COVID, right? And you've seen probably news stories from around the country that there seem to be more children who are hospitalized now than at other points in the course of the pandemic. And so I think it is something to be taken seriously, particularly because very soon children will be able to get vaccinated, right? So I think it's not that children will have to wear masks forever, but once the vaccines are approved for children in that school age, or kind of 5 to 12 period, that will make their risk even far lower. And so I think right now it's about getting us to that point where kids can safely get the vaccine. So
Well, everything is trial, and everything is everyone said trial, and everyone was in the beginning always a trial phrase and all this, but many lives are saved today because of the vaccine.
That's
and
right.
Me myself who just hate needles, not that I'm against the vaccine, just hate needles, but I decided I'm going to make my appointment at Montefiore to get my shot. And so I'm encouraging everyone, if, whether or not the vaccinated can spread it to the vaccinated, at least we're not going to be on a life support machine and all this stuff. So, but
right.
To just hear the truth that you can still spread it. Avril, is encouraging people, as I tell folks when they come around me, whether you're vaccinated or not, please wear your mask. Mm-hmm. Folks take offense and they want to tell you, well, hey, I'm fully vaccinated, but we hear it here from Dr. Meyerowitz. from Montefiore, Albert Einstein College of Medicine. We're here tonight to give you some more information to make us think clearly, and instead of all these different false information that's going around, people, protect yourself. Can a person become immune to COVID?
Yes. So people do become immune. What the question is, how long that immunity lasts. That's what we're dealing with, even with the vaccines. So it was clear even last summer that we were starting to see some reinfections, and so there is really good long-lasting immunity to preventing severe outcomes as we're seeing for vaccinated people. And the reason for the recent recommendations about boosters is because of the concern about some waning immunity from early vaccination and the risk essentially of infection despite vaccination after a period of time. And we're going to have to see whether that third dose will kind of keep people so-called immune for a much longer period of time, or whether there will need to be periodic further boosters down the line. And that, again, we don't have that information now because we haven't lived through that period yet. Right.
Thank you so much, Dr. Meyerowitz and Robert Press. You came on late, but you did get your answer, because that was my concern also, is that my antibody, no matter, I took it in March, I took it in July, came back positive each time. So I keep saying, thank you, I have some immunity.
Yeah.
But but a lot of folks who took it 6, 7, 8 months ago walking around and they're saying, I'm fully vaccinated. And I used to tell people, maybe you need to go back and get checked, because you could be walking around and say, I had it 8 months ago, but you don't know your levels right now.
Right. And again, what's hard about that is we don't exactly know, so that there are many different tests, and we don't exactly know what the right cutoffs are yet. And so I think what you're saying makes a lot of sense, and that hopefully is where we'll be going, meaning at some point, so after this third dose, what may eventually happen is we'll be able to check people's levels in a standardized way, and if they fall below a certain threshold, it might be that it's time to get another booster. Again, I think that's one reasonable possibility. That's not where we are now, because again, even if you got your antibody checked, it's not a standardized test, and we don't exactly know what level indicates protection and what doesn't with the various tests yet.
Thank you. And Dr. Meyerowitz mentioned earlier, speak to your doctor, because he's not here to be your doctor tonight, because as one person wrote, he was tested, he had the immunity, and they refused to give him the shot because they said he became immune to the COVID.
So if I'm not sure the specifics of that, but if you should still, people should not be using that test to make decisions about what vaccines you're getting. So if you were in a position where you got one dose of a Pfizer or a Moderna vaccine, for instance, a single dose, and then someone checked your antibody and you had a detectable antibody, you should still get the second dose, because that level, even though you may have a positive level, it may not be enough to protect you. And so, so if you're in that position, and you, I think you probably should just readdress that with whoever told you that, if that's the specific situation.
Thank you so much for that. And for those who are out there, we get the information tonight, and follow up with your doctor, find out more. And as Dr. Meyerowitz says, in September, the booster for everyone will be available, or it's available now, but just for the more severe?
So the boosters will start to be available from the FDA announcement. They'll start to be available September 20th. And this is for the general public. If you're an immunocompromised patient, meaning a patient with a weakened immune system, the boosters are probably already available to you, but check with your doctor. But after September 20th, you will be if you have a normal immune system, you're not an immunocompromised person, you'll be eligible for a booster 8 months after your last dose. So look at your vaccine card, whatever that last dose is. If it was March, for instance, then you'll be eligible to get your third dose in November.
And imagine me, I would be getting my booster in 2022 because I'm just about to take my vaccine. So I have to wait 8 months after my second shot.
That's right. Yep. Yeah.
Oh.
Yeah. So one way to think about it is the schedule now is going to be for Pfizer, it's first dose, a dose 3 weeks later, and then a dose 8 months after that. And for Moderna, it's a dose and then a second dose 4 weeks after that, and then a third dose 8 months after the second dose.
You heard it here, and for everyone who tune in, share this information. And when you share it, you're also empowering your friends and your family. Continue to share the information. Continue to wear your mask, wash your hands, do everything as if it's the first time hearing about the vaccine. Folks who don't believe in it, it's real. I've seen enough family and friends suffer these ailments, and I encourage everyone, speak to your doctor. And if you're thinking about fear, you heard the doctor give you the information tonight why we need to think about each other and our health. But continue to wear your mask because there is no such thing as you cannot be reinfected.
That's right.
Okay, so you're joined here by Dr. Meyerowitz from Montefiore, Albert Einstein College of Medicine, and we cannot thank you enough. And as Josephine and everyone say, thank you for this information. And when folks can say thank you, it means it's something they wanted to hear. And I know it helped me to make a better decision because a lot of times you hear all these crazy stories and, you hear, oh, Jesse Jackson, he had but now he has it, but we don't know the story, but we just run with what the press put out there. So I always tell people, unless I go on to find out my information, I just don't go based on what is put out there. I speak to the expert. So folks, take care of yourself, and the doctor is here. I want to thank Montefiore, Albert Einstein College of Medicine, and Dr. Eric Meyerowitz for coming on, taking your time to empower our community and people around the world, because one of the first person that logged on was from Florida. So, each one reach one. And as we spread this program, someone's life will change.
Thank you for doing this, Avril. Thanks for having me. I think what you're doing is so important. So I'm really glad to be here again. So,
and thank you. And thank you. And I thank you to the staff and everyone at Montefiore, Einstein College of Medicine. Thank you for being here.
Have a good night. Take care.
You too. You too. Folks, you're out there, you get the information. Feel free to share this information. Do not take it for yourself. Just remember, each one, reach one. I want to thank the people who make it possible. Best Deal Car Service, McCall's Bronxwood Funeral Home, Teddy Nissan of the Bronx. You need a car. That's the place to be. You don't take your vaccine, McCall's Bronxwood Funeral Home. And if you have a case that you want to talk about, remember, Attorney Hugh Campbell, the only attorney in the Bronx who know how to fight your case in the courtroom, no matter who the other attorney is. But I bring you the people who can help you. So if you're here and you're looking for help, just give the Avril Show a call and I will get you the right people. Whether it's law, housing, divorce, whatever you're going through, Attorney Hugh Campbell. And he's not too far away, right here, Gun Hill Road in the Bronx. Just Google his name, Attorney Hugh Campbell. And remember, you're looking for a car, Teddy Nissan of the Bronx. And if you don't feel like driving home, remember, Best Deal Car Service. That's the man in the community giving back, making a difference, and doing so much to change the community. McCall's Bronxwood, most people don't want to hear that name. McCall's Bronxwood Funeral Home. I know when you hear that, the first thing you think about the vaccine. Get it. Get the vaccine if you don't want to call my calls bounce with funeral home. And for you, if you're out there and you're listening, come with me when I'm going because I want company. So thanks to everyone for tuning in tonight. Share this program so someone else's life can be changed. To all my sponsors who make it possible, and remember to tune into radio 1 a.m. 1000 in the U.S. Virgin Islands, and you will be hearing more coming up about that right here on this show. To everyone, thank you. Laverne, stop showing off because you took your vaccine. Problem Fips, how do you know you're getting the, what you say, your question? Well, that's a question I could answer for you because they're not going to give you the third if you didn't get the first. So you know that. So Robert Press, good question, but speak to these doctors that tell you you don't need to take it. That's a slap in the face because if you go out and get infected tomorrow, then who is to be blamed? We got to talk about this some more, Robert, right after the show. To everyone out there, thank you, thank you, thank you. And as I say, spread the show, share the information, and remember, each one, reach one. This is Avril telling you God loves you, and so do I. I'm out.